New York.
Well, surgeries are back in hospitals, and with that comes the need for physical therapy as patients recover. Joining us now to talk about that is Latasha Raineault, a physical therapist with the Hartford Healthcare Rehabilitation Network. Latasha, welcome.
Thank you. Thanks for having me.
So with essential surgeries being performed, patients are having their surgeries after the delay during COVID. However, they're putting off physical therapy. Tell us what you're seeing.
So we're finding that some of our patients are a little hesitant to come out into the community. Some of them might be delaying their physical therapy visits or pushing things off until they feel like it's a safe time. But we're ready for you. Our offices are safe. We've been open through all this, and we've been prepared for our patients to come into the clinics.
All right, let's talk about why it's so important for patients to participate in physical therapy after their surgeries. What can happen if they skip it?
Right. So, our surgeons are talented and they help put people back together. Our role as physical therapists are really to take them from that place back to full function. So, delaying physical therapy can really prolong that time period where they're in pain or in discomfort. We can see people having loss of range of motion, weaknesses, things that can really create some compensation and some substitutions that throw off how their bodies move. That might not impact them today, but can play a big challenge and a big problem later down the line.
Let's talk about complications. What are some of the complications that patients could see?
Yeah. So, again, the loss of range of motion, they could have loss of strength. There's always that potential that they might need to go back and have a revision for not completing and fulfilling the full caseload or the full quality of care post the surgery. So we're really trying to get people in and initiate that care in order to keep them moving and moving in the right direction so they're able to get back to the things that they want to do, being able to get up and down from chairs, going up and down stairs, being able to get back to their activities that they previously were doing.
Great point. No one wants to have surgery again. Wow. All right. What should patients know prior to coming in for physical therapy?
So they should know that we're taking things seriously. We're screening all of our patients before they even come into the door. We're taking temperatures. We're really following social distancing, keeping things clean, disinfecting things in between. So, I say commonly, when I'm at work, I feel like that's the safest environment that I'm at. We have control over that, and we're keeping ourselves and our patients safe. One of the other great things that we are happy to be able to offer is virtual health. So for those people who might not be perfectly comfortable coming into the clinic each and every time or want that option, we're able to take care of you via your computer or your phone using our MyChart app and do your physical therapy visits that way. So you get that same one-on-one personalized care just in the comfort of your home.
And how's that working, Latasha? Tell us, how are people adapting? Are they able to do their exercises virtually?
Yeah, they are. We're having to be a little creative. We're using things around the house to help them work through their exercises. They might be using things like cans of soup or using a chair in their home to do some squats too. So it's creativity on our end and the patient's end, but they're getting some really good results and they're getting some good outcomes. And from what I've gotten from feedback from patients, they like it.
All right, Latasha Raineault, physical therapist with the Hartford Healthcare Rehabilitation Network. Thanks for joining us. Some great insight there.
Thanks for having me. I appreciate it.